Hi, and welcome to Understanding Substance Related and Addictive Disorders, a Lloyd and Lloyd Family Workshop Series presentation by Tony Lloyd. At this time, I'd like to give thanks to Ms. Cooper for making this opportunity possible for us to present virtually to our families. We'd also like to think about this time during this pandemic, to think about persons who are more vulnerable to using substances. And hopefully this workshop would help to give us some information on how we could help. In this series, you will learn how to define substance use disorders. You'll explore the trajectory of Anna, examine who is at risk and why, understand how substance use disorders are diagnosed, review how Newark and the US are affected by substance use disorders, understand how to help your loved ones addicted to substances. What are substance use disorders? According to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, it is a cluster of cognitive, behavioral, and physiological symptoms indicating that the individual continues using the substance despite significant substance-related problems. Now, these substance-related problems would range anywhere from DUIs, driving under the influence, to actually being, in some cases, sent to do some time. In other cases, causing problems at home, interpersonal relationship problems, loss of employment, and it ranges from mild to severe. Now I'm going to introduce you to Anna. I'd like to, share, of course, that these topics tend to create strong, emotional or feelings, around perhaps use of substances or being affected by someone who may have used or perhaps is now in treatment. We look forward to receiving your comments, your shares, and going through this together. So Anna had a normal birth, happy disposition. Her mom is a nurse and works the night shift every other night. Dad has been in and out of jobs, just adjusting to a new job when Anna was born. Dad is physically and verbally abusive to mom whenever funds are low. Dad gets incarcerated for drinking under the influence. And Dad has alcohol-related withdrawals while in prison, which led, mom to sort of trying to put things together and wondering if perhaps his problem with alcohol was the reason why he was in and out of jobs and was verbally and physically abusive toward her. Anna is now 7. Mom and dad separate, and these are her childhood experiences. Dad starts treatment. Anna has anger toward dad and does not like visiting him. She loves her friends at school, she loves learning, and she has a pretty good relationship with mom. She's close to mom. What do you think puts Anna at risk of developing substance use disorder? What do you think puts her at risk? Of course, I'm not here to see you, give me your answers, but just to think about it, what do you think puts Anna at risk? Okay, so some of the things that would put Anna at risk would be going back to their history. Some of the risk factors would be the separation between mom and dad. In some ways, it would be protective because dad is now, the home influence would be made a bit better. Yet, on the other hand, mom is now a single parent and would have to deal with everything financially, as well as making sure that Anna has proper supervision. And, mom works night shifts. So it'll be a little bit difficult on her with regard to monitoring Anna's activities. Some other risk factors would be the fact that Anna has witnessed the physical violence and the verbal abuse toward her mom. And she has also witnessed dad using or being under the influence. So those are some of the risk factors for Anna. Right, so Anna, birth to 7 years old, risk factors and protective factors. So risk factors are things that put us at a greater sense of vulnerability to a particular illness. And protective factors are those that help shield us from the impact of those illnesses being exacerbated, particularly those genetically based illnesses for which alcohol has a high genetic correlation from as much as 50 to 60%. Right. So some of the risk factors again: Anna witnessed violence in the home, parents separated, possible loss of income, lack of parental supervision with mom's job, dad has alcohol use disorder. Some protective factors: stability in a school environment. She really likes school and she has friends there. Close relationship with mom. Mom also acted as a role model because she showed Anna what she will and she won't accept in a relationship. And her father moved out and is in treatment, which would minimize her exposure to violence. What influences the risks of developing substance use disorder? And we're going to look at three pieces: the environment, the person, and the age of introduction to the drug. And we're going to start with the environment, and I'm just going to share with you a nice 1 minute something video.
What causes drug addiction? To find out, researchers in the 70s investigated rats in empty cages with normal and drug water. Because older rats chose the drug water, became addicted, and died of malnutrition, they concluded that drugs are uncontrollable and that a global war on drugs was necessary. But another scientist thought it was obvious that lonely rats are more in cages would choose drugs over water. So he put them in a lush cage called Rat Park with predators and everything a rat could want. His rats chose not to use drugs. He even used addicted rats from the lonely cages, who gradually reduced to become drug-free and unharmed. That's like many humans who get strong drugs at hospitals. And it doesn't stop when they go home to their own family. While alone and unhappy, street users turn into desperate addicts. These experiments show that chemical addiction is not the only thing that matters in drug abuse. And a person's access to a lush cage is even more important than making drugs unavailable and criminalizing its users.
Okay, and that's just something for us to think about in terms of that experiment and what it found. It's really, really crucial, with regard to stigma around drug use. Sometimes when we have someone who is using, and it's difficult to be around that person. They're irritable if they're abusive, if they steal from you, and so just ensuring when they are ready for treatment that they do have a lot of family support makes all the difference in terms of their treatment. It does help. What have we learned from those experiments? Well, we've learned obviously that humans aren't rats. We take our environments with us, right? So whatever experiences that we would have had in our environment growing up, we tend to take that with us throughout our lives, whether it was positive or negative, traumatic or not. And we can infuse our environments, however, in ways that mitigate risks. So even if we've had, for example, not all persons whose parents separate are at higher risk for substance use disorders or other disorders, right? Because they may have those risks mitigated by loving, supportive, extended families, by strong school cultures, right? All of these things make a difference in building individual resilience, which then leads to us having an opportunity to make more pro-social choices. Again, we looked at adverse childhood experiences in one of our previous presentations, and it comes up here again because these adverse childhood experiences have a real multiplying effect, where it leads, for example, experienced physical abuse, it's times 1.8 the risk of developing substance use disorders. For emotional abuse, it's times 1.6. Sexual, it's two times more likely to happen that a person who has been sexually abused would develop a substance use disorder. Emotional, times 1.9. Physical neglect, times 1.1. Violence in the home, times 1.6. Substance use in the home, times 2.4. So you see that as being the strongest influencer there. Household mental health disorders, times 1.7. And you might think, well, what are mental health disorders? Sometimes we don't talk about it a lot. And let's say you have someone in a family who's very, very withdrawn, most likely suffering from depression. That is a mental health disorder, right? Anxiety is a mental health disorder. Okay, of course, severe, when you look at these things in its severity, right? So if you experience anxiety once in a while because you have to take a test or something, it is not a mental health disorder. It's just having to learn new ways of coping with that brief anxiety around exams. Parental separation or divorce is times 1.8. Incarcerated household member, times 1.7. So it's just good for us to have an idea of the impact of some of these experiences on our children, so that we know how to infuse their lives with sports, with programs like the Resilient Stars program, with other activities like debate club or chess club or the cheerleading clubs, right? These give more opportunity for kids to choose more pro-social choices. Additional risk factors: peer substance use. So the adolescent brain is really, really super vulnerable and not able to handle drug use. In fact, I remember going to a CE, continuing education workshop, where the presenter said that the brain literally stops its maturation at the age of the first marijuana use for that particular drug. And so, someone started to use at 17. She's saying that emotionally that person is sort of stuck at a 17-year-old age, even when they turn 40, right? So it sort of really, really makes us aware of how we have to really safeguard our kids and make sure that they have the tools to choose not to use drugs. Use before 14 more likely to develop substance use disorder compared to someone who started using after 21. Drug availability is also something that could be a risk factor. Low perceived risk, right? So if we think, oh, that drug isn't going to do anything to me, or I'm not going to get addicted to that drug, then why not try? And that's often the thought process behind that. High perceived reward or normalcy. So, hey, all my friends are doing it. So, they feel great. They're more able to, be lively and talkative. If they're using alcohol, for example, you feel good, at ease. It reduces inhibitions. Low parental supervision is another risk factor. Low socioeconomic status, partially mediated. That's partially mediated by having a lot more fun activities for kids, right? And white or mixed race children are that's actually a risk factor as well, because they are more likely to try the prescription opioids. Okay, protective factors. Adult role models, as in Anna's case, she had her mom. Parental discussion of risks, as it's really important, for us as parents to talk to our kids about these risks, whether we're talking to them about alcohol use or we're talking to them about their genetic predispositions. Those are some really, really important conversations to have, and also not to scare anyone if they have, someone who has alcoholism in their family and is like, okay, I have those genes. It's not to scare us, but to say, okay, I have these genes that predisposes me to these risks, but since I know that information, I know that I could choose to do and eat things that would benefit me overall. Engagement in enriching activities, the sports and the clubs. Academic achievement is another protective factor. That was definitely a huge protective factor when I was growing up. Really, really enjoyed studying. A sense of connectedness at the home, right? Having, if it's not mom, it's grandma, grandpa, cousins. Some of us grew up in extended households, so we had that connectedness at home. A sense of connectedness at school or the community. Now we're back to Anna. She's 11. She's in the selfie age, right? What's new with Anna? She's still mad at her dad. Her friends have started drinking their parents' alcohol, and she hasn't tried it yet. And Anna has a family history of heavy drinking. Her dad's dad drank. Her dad's mom drank, and so this is something that has a very strong genetic predisposition, as I've mentioned earlier. And now we're going to talk about the person, the genetic predisposition, right? To who's at risk for drugs. Heritability of substance use disorders. Alcohol use disorders, as I mentioned, has a 50 to 60% risk tied to it, which is pretty high, right? Other drug use disorders, 40 to 50%. Also, we want to think about the person's temperament and personality traits. If they are sensation seeking or impulsive, or they have impulsivity, we'd have to teach them how to manage that impulsivity a little bit better, giving themselves some time to think things through, to think about the long-term costs of doing certain activities. Anna is now 12. She's offered a beer and she accepts it. It makes her feel energized and more herself than ever before. She seeks parties and access to more beer. She tries Oxycontin and she loves it. She starts dating someone who sells opioids at school. She moves out of her mom's house to live with her boyfriend at 16. She couldn't take mom's rules. Mom wanted her to, pull her grades together, get herself together. And so she cuts off relations with all of her quote unquote judgmental friends and her mom. the impact of drugs on our brain. So we're just going to watch another short video clip just to understand how drugs impact our brains.
Whitney Houston's death has us talking about her fight with addiction for so many years. And we don't know if it played a role in her death, but we do know that for more than 23 million Americans fighting addiction, quitting, it's not a matter of willpower. New research actually reveals that substance abuse causes lasting changes in brain function. With our host of such a therapist, doctor, or listeners on to do everything basically. All right, let's talk about your piece, and I guess why did you choose? This is your expertise, the function of the brain.
What exactly the brain looks like in somebody who has addiction who's going through this is a pretty remarkable thing. I think it gives us a lot of insight into how it should have best be treated, and also understand it. That's what I'm trying to do here. I want to explain a couple of things quickly. First of all, this idea that someone has some sort of anticipation of taking the substance. That's sort of the first step. But then there are two important steps after that in the brain. Stay with me here. So imagine, for example, just take a look at this animation I'm about to show you, that someone takes a drug of some sort. What happens there, it's in the middle of the brain, is that there's a sense of euphoria. That's building in there in small factors. That makes you feel good. That actually.
Drug, we're talking everything from cocaine to Xanax.
Yeah, just about any kind of drug. Not even drugs necessarily. It can be other things too, sort of food substances, sugar, for example, can be a certain addiction quality. But I think what's important is the next step. So you have the euphoria, but someone who's a true addict, take a look at this picture here. On the left side, you see the bright areas? That's still feeling good. That's the euphoria. But on the right side is someone who has an addiction. Not as much of that that's not as relevant. Why? Because they need more and more of the substance to try and get that euphoria back. Think about that for a second. You take the substance, you feel good, but an addict, that good feeling doesn't last. So what do? You take more and keep going than ever before. And that's sort of the basic, sort of simplistic, but basic form of addiction.
Are those changes permanent?
Well, they last a long time. And exactly how long is a little bit of a subject of controversy. People say you can eventually get to the point where your brain does feel natural pleasure again. That can take some time. What doesn't go away is this idea of memory of the addiction. Let's say you're a cigarette smoker, you've been for 10 years, pick up another cigarette and start smoking again, and right away you're back into addiction. Whereas if you never smoked before, it would take you some time to build up that addiction.
It's like what they say, folks that we know that have gone through treatments, like once an addict, always an addict, and there's some truth to that, right? It's a constant battle to stay away from temptation or feel that euphoria, right?
That's right. You see that, but I want to show you pictures of the brain to really explain why that is. You see that dark areas of the brain, you need a lot of substance to get that euphoria back. So that's why we do have somebody who said they said 3 days in a year withdrawal, which is painful, 3 months, most people say 3 years, and 3 years is natural sort of pleasure again from substances.
Okay, so I hope that was really helpful, right? And so we get to understand that it's not a matter of willpower, right? When we're trying to tell somebody, oh, just you could drop it, why are you doing this? It is really changes taking place in the brain that could take up to 3 years to really being off of the drug to get the brain back as it should be. All right, so now Anna is an adult. She's lost her job as she was caught stealing to support her drug use. She cannot afford prescription opioids, so she goes to heroin. She experiences a lot of guilt and regrets over what she feels she could have been. She wanted to be a nurse like her mom. She's been hospitalized for infections, but she's trying to avoid acquiring HIV. She does not have any money, so she tries to sell everything that she does have to acquire the drug. And she does not have any healthy relationships whatsoever. So Anna's world has become very much obsessed with the drug as her main pleasure-seeking thing. And so she's also very lonely, as you could tell from not having the deep interpersonal relationships that we we strive for as human beings. Does Anna have a substance use disorder? And this is where it's about understanding diagnosis. And so remember that book that I showed you in the beginning, the very first slide, well, the second slide, the DSM-5. So for us to understand if Anna has a diagnosis according to this DSM-5, and it would be stored in the NJ-SAMS, right? If she goes to a treatment center, they're going to take all of her information, and all of this information will be stored in the NJ-SAMS so that research could continually be done on persons with substance use disorders. So we have the 4 R's: risk of bodily harm, relationship trouble. Does she have? So we're going to check risk of bodily harm, yes. Relationship trouble, yes. Role failure, yes. So that is her ability to, work, her ability to support herself. That has been gone. Repeated attempts to cut back. 4 C's, loss of control, yes. Continued use despite harm, yes. Compulsion, meaning that her whole life is surrounded by just this drug. Craving, yes. Withdrawal, yes. Tolerance, yes. And so Anna actually has a severe opioid substance use disorder. How does Anna get help? What is her motivation to change? And so we have the Prochaska and Diclemente stages of change model. Pre-contemplation, sort of thinking, I have a problem, but maybe not really. Contemplation, okay, people are saying that I have a problem, I'm not too sure yet, but maybe I should think about what they're saying. Preparation, you're actually going to sort of start looking into researching different treatment options. Action, you've walked into a treatment center, you're ready to go through there. In my time, interviewing patients to do the NJ-SAM could go anywhere from an hour if you're really fast to 2 hours if you're just learning, right? So taking actionable steps. Maintenance, so you're staying away from people, places, things. You are maintaining your sobriety. You're going to your 12-step meetings to get that peer support. And what is really, really important about this model is that relapse is a part of it. And so you see people relapsing and going back quite often, and it takes a lot of courage to start again. And I think it's a bit like when we're learning to walk even. We never just fall down and say, okay, that's it, I'm never getting up again, right? We fall down, we get up, we fall down, and we get up. And so relapse is a part of that health cycle, that change model. Anna gets clean. She's motivated to get clean. She wants to be a nurse's aide. She moves back home with her mom. She starts attending classes. She's actually clean for 3 weeks, and her ex-boyfriend calls her and she relapses, right? And so we're gonna let you finish your thoughts, or just think of Anna and how her trajectory would look moving forward. Maybe she would get clean again. We don't know. So let's look now at the prevalence of alcohol use disorder in the U.S. And so it's very common. It's a very common disorder. Based on a 12-month prevalence, it's estimated at 4.6% among 12 to 17-year-olds. So you see that adolescent group there. 8 to 5% prevalence among adults 18 and older. Rates of the disorder are higher among adult men, 12.4% compared to women, 4.9%. And these statistics are based on the DSM-5. Prevalence of substance use disorders in the U.S. So substance use treatment jumped from 37.5% in 2016 to 54.9% in 2017. Heroin use, while first-time usage of heroin decreased more than 50%, and treatment for heroin use increased in 2017 compared to 2016. heroin-related deaths continue to rise in that last year. And then we have the sources here, of course, that I would be sharing with you. Substance abuse in Newark. The city of Newark was the top municipality in Essex County for substance abuse admissions in 2016. 3,216 residents sought treatment in Newark, accounting for nearly 50% of all resident treatment admissions in the state. The biggest problem in the city was heroin, accounting for 46% of Newark's admissions with a total of 1,471. How to help your loved ones. Did you know that only 10% of persons with substance use disorders are getting the treatment they need? All right, so this slide, when we think about the stigma, minimizing the stigma to seeking help, it's like people may be aware that they have mental health challenges, but they don't want to deal with thinking or other people thinking that something is somehow wrong with them, right? And so the culture has to change a bit to knowing that getting help is brave. Being the best version of yourself is brave. Okay, set boundaries for yourself. If you are a caregiver, you don't want to get yourself in a situation where you are creating codependence, right? Which is pretty much having your loved one, bailing them out every time, over and over. You are extending yourself, your resources, and they keep, relapsing. Part of it has to be a personal decision that, okay, if you're going to walk this road, then I need to set boundaries to protect myself as well. Be aware of the treatment centers available and share the resources with the person, right? So the Rutgers has a directory. Again, I've placed all of these resources in the link below our video. So please like it, share it, subscribe it, and click on the links, right? Another thing, we want to encourage you to go to the 12-step meetings with your loved one. Listen to some of the other people, the other persons share. It's quite I would say humbling experience. Keep your loved ones included in healthy activities, jogging, walks at the park. Encourage your family to have events that exclude alcohol and drug use. All right, so in this series, we've come to the end. And in this series, we've discussed the definition of substance use disorders. We've looked at Anna's life story or her trajectory. We looked at who's at risk and why. We looked at how substance use disorders are diagnosed. We looked at how our city, Newark, is affected and the U.S. And we also looked at how to help our loved ones who are addicted to substances. Also have contact information if you want more resources, you need more information. Please leave your comments below the video, and feel free to reach out. Please leave your comments, like our video, subscribe to our channel, and share the video with your friends. We could be sharing this information and hopefully touching lives. Thank you so much.